Pelvic inflammatory disease is the term that covers any form of infection of the woman's reproductive tract, of the vagina, the cervix, the womb, the fallopian tubes, or the ovary. Most commonly, it's due to a sexually transmitted infection, and it can occur in women of any age. The diagnosis of pelvic inflammatory disease usually follows your presentation with symptoms of vaginal discharge or abdominal pain, or both. It's important to remember that about 70% of women who have PID due to chlamydial infection may not have early symptoms, but that unfortunately means that they may go on to have later complications. If you're diagnosed with pelvic inflammatory disease and you have a vaginal swab that has grown an organism in the laboratory, you will be offered treatment with antibiotics, usually over a 2-week period. It's really important to make sure that your sexual partner is also screened and treated. Most cases of PID are due to chlamydia or other organisms, and they respond promptly to a course of antibiotics. Some cases, however, may give rise to long-term problems, including difficulties in becoming pregnant or chronic pain. That's why it's so important that firstly, you try to prevent developing pelvic inflammatory disease by always using some form of barrier contraception. And if you do think that you've got symptoms or you are at risk of having an infection, then please go along and seek help and advice.